So this session is about the commercial determinant of health, which is a growing issue, and as it should be, because it helps us to understand the link and similarities between the lobbying strategies of different industries, like food, tobacco, alcohol, energy fossil, you name it. And understand these strategies, these lobbying strategies, is important to know how to deal with them. And we have to be aware of how it impacts the public health decision-making process. So we will better understand how it works with our speakers' knowledge, experience, and expertise. We will have some examples from different countries, France, Ireland, but also at the EU level with Florence. But before that, we will start with a general overview of the situation with Mark Petticrew. Mark is a public health professor at the London School of Hygiene and Tropical Medicine. And Mark, you can come. The floor is yours.
Thanks very much, Myriam. And thanks for the invitation to speak and actually to follow on from a really great set of presentations and discussions this morning. So I think this does follow on, or it's planned to follow on from those discussions. I should say as well, just in terms of conflicts of interest, a lot of my research in this area has been funded from the Spectrum Consortium, which is funded by research councils, government departments and independent charities, and none of it from alcohol industry actors or front groups. So what I wanted to start really, or what I wanted to focus on, is political strategies. Oops, just set my watch to make sure I don't talk all afternoon. So you'll probably have seen this diagram from the Lancet Commission papers on the commercial determinants of health, which sets out the 7 practices that negatively affect health. And I want to just focus on the top one, which is the political practices, and relate this to some of the discussions we've been having already. And the political practices, this is a short list. This could be 100 bullet points long, but it includes some of the things that we've heard about, demands for partnership with the industry, claims that in the case of the alcohol industry, we are part of the solution. But what we know from a good evidence base and numerous evaluations, there's no evidence that this works, and there's plenty of evidence that these sorts of partnerships are harmful. We've heard about lobbying, using political processes to insert misinformation into decision-making processes, for example, through consultations. And I think Catherine talked a bit about the storm of misinformation from the industry that's out there. And that includes denying and distorting the evidence on alcohol harms. So a lot of the work that we've done and others have done has demonstrated the extent to which the alcohol industry denies and distorts the evidence on the harms relating to cancers, particularly breast and colorectal cancer, fetal alcohol syndrome disorders, cardiovascular disease, and so on. And they draw very heavily on their colleagues in the tobacco industry, setting up front groups, alcohol industry-fronted charities, and corporate social responsibility activities, CSR. And these activities, this distortion of the evidence on the harms, is also designed to influence policymakers as well as the public. The 4th practice on the list is shifting blame to consumers, and a major element of alcohol industry practices is to encourage you to take the blame for those harms and to distract from the harms that the industry causes. And that's where industry slogans like drink in moderation, drink responsibly, and so on come from. So that also distracts away from policies that actually work, or policies which have an evidence base, minimum unit pricing, restrictions on marketing and advertising, and so on. The corporate social responsibility activities of the alcohol industry are also designed to undermine effective policies. So one of the things that I think, and surprises me, that isn't more widely known, is that the alcohol industry is hugely active in schools internationally. It does this through a number of different front groups. In the UK, they use organisations, or they have used organisations like Drinkaware, the industry-funded charity. There's an organisation called the Alcohol Education Trust, now called the Talk About Trust. We've analysed some of their materials, a lot of their materials. Diageo is possibly the most active, and it runs a theatre group called Smashed, which is active in countries all around the world, which purportedly teaches school children about underage drinking, but is actually used as a cover for misinformation about the alcohol harms we've just heard about, and to promote and normalise alcohol consumption. So I looked at its website yesterday. It's in 38 countries currently, and its goal is to reach 30 million children by 2030. So that's quite a shocking aim. That's 30 million children targeted with misinformation about alcohol harms, and 30 million children to which alcohol is promoted and normalised. So that's going on our watch at the minute. And these sorts of CSR practices also undermine policy, because the industry can then go to policymakers and say, you don't need to regulate us any more closely, leave it to self-regulation, because look at all the good things that we're doing in schools, and relying on people not to look too closely at what those things are. And the other practice, of course, is to use these activities as branding opportunities, which I'll come back to. We did hear a bit, we had quite a useful discussion this morning about norms and norm setting. Many of these practices are intended to shape norms, and norms are social expectations, often unwritten, about how people should behave, how individuals and communities and the public should behave. And commercial actors like the alcohol industry respond to norms, but they seek to shape norms. They shape our ideas and beliefs and practices, including our political practices. So in terms of the political norms, one of the norms that's being put in place by the alcohol and other harmful industries is that it's normal to partner with what is a conflicted, mendacious industry that has a track record in misleading the public and policymakers. But despite that, the alcohol industry would argue, we need to be at the table, we're part of the solution. These sorts of partnerships are misused by these industries and are unethical. And the other thing that I think we often forget whenever we read justifications of these sorts of partnerships is that the alcohol industry has zero competence in public health. They are not public health actors. They're in schools, as I said, in 38 countries. I might have missed this, but Johnny Walker, Smirnoff, Guinness have no competence in education or in public health, but they're in schools around the world. So I think we sometimes let our boundaries become eroded in this respect. Businesses, whether it's the alcohol industry or other industries, have no competence in public health. So I'm getting quite squeaky voiced now. So this is, I would suggest, another example of boundary erosion in the UK at the minute. And this is Heineken apparently promoting drink driving awareness coming up to Christmas. And two things, thanks very much, Caroline. Two things to say about this. First of all, the first thing is that alcohol industry drink driving campaigns have been really extensively evaluated. There's little evidence that they work. And the second thing is that they're used to promote the brand. So here we have Heineken partnering with the government, with the Department of Transport in the UK to promote its zero alcohol products. And we've heard a little bit about the zero alcohol products. I think this is unethical, and it's used as one of the political practices to influence policy, to distract from effective measures that work, and also to portray Heineken in the eyes of policymakers and the public as a public health actor. So, I mentioned individual responsibility earlier, just briefly. Part of the policy substitution strategy of harmful industries is to shift the blame to individuals and to individual responsibility. So just really briefly, as I'm sure many of you know, there's a long history of this across other industries. So for example, the term litter bug was coined by the plastics industry and the packaging industry to shift the blame from the industry onto people who were creating the litter. Carbon footprint was developed by British Petroleum, I think, in conjunction with one of the big advertising industries, in order to pass the responsibility for fossil fuel destruction of the environment to you as a consumer for not knowing your carbon footprint. So we should see these sorts of industry responsibility campaigns in exactly the same, through the same lens. Like enjoy responsibly, that's what that's about. It's shifting the blame and shifting the harms and shifting the responsibility to the consumer. So there's nothing in this which says market responsibly, don't target school children responsibly. It's about you. You need to enjoy our product responsibly. And if any of these harms are caused, cancers, cardiovascular disease, I'm afraid you weren't responsible enough. Excuse me. That's just another of these responsibility campaigns. Some of you may know about it. The motor industry in the 1920s and 30s in the US came up with the idea of jaywalking to put the blame onto pedestrians as opposed to drivers. And up until the 1920s, drivers were seen as the cause of accidents. After this campaign, big PR campaign, which created and promoted the idea of jaywalking, then the responsibility was shifted to you. So if you were knocked down or killed by a car, it was because you were jaywalking. It wasn't the car or the driver. Actually, we heard a little bit about this morning, and I think Florence and others, we were talking about it over lunch. One of the less visible strategies is to, which is used to influence and undermine policy, is to divide the public health community. And the tobacco industry used this very assiduously. It created an exploited division among academic communities. The tobacco industry project to do this was called Project Sunrise. This is a quote from a paper in 2006 about Philip Morris's Project Sunrise. I put this up because we can think about this and the extent to which this applies to some of the debates in alcohol, in the world of alcohol. So Project Sunrise laid out an explicit divide and conquer strategy against the tobacco control movement, proposing the establishment of relationships with Philip Morris identified moderate tobacco control individuals and organisations and the marginalisations of others. Philip Morris planned to use carefully orchestrated efforts to exploit existing differences of opinion within tobacco control, weakening its opponents by working with them. Philip Morris also planned to thwart tobacco industry delegitimization by repositioning itself as responsible. In this one paragraph, I think we can take away that and think about it in relation to low alcohol products, vaping, other industry activities, which actively, like Project Sunrise, seek to identify splits in the public health community and widen and exploit them. So that's another of these strategies or political strategies, which also applies to alcohol. Yes, so related to that, the other thing which I suppose it's another less visible strategy, but it's starting to be written about it in the literature, and there are a couple of papers in Health Promotion International over the past couple of weeks, the journal. So it involves industry attacking experts and scientific expertise. X is a well-known, not the social media company, the individual, whoever it may be, is a well-known temperance campaigner. Don't trust their research. I'm sure other alcohol researchers in the room have experienced this. The use of dark money think tanks funded by the alcohol industry and funded by many others, which then help to develop policy and influence politicians. And also, we heard a little bit this morning about the media. There's the use of the media to undermine policy, to misrepresent the harms, and to hide or distort evidence. So these are all part of the, I suppose, toolbox of strategies which the alcohol industry, like other harmful industries, draws upon. And we heard about from John about the Chief Medical Officer's guidelines in the UK. These attack strategies, that's one of the memories I have of that process. And it did surprise me at the time, the amount of information about the guideline process, about the science, which was excellent, which underlaid the development of the guidelines, but also that the attacks that were directed towards the guidelines committee. I was always very surprised to see ourselves described as an anti-drink lobby, that we drew up official safety limits. But there were particular newspapers that were used as a conduit of alcohol industry misinformation. I think I'd consider the Times to be one of them, incidentally. But using the media to influence policy in this way, and you can trace elements of the media, I think, not just in the UK, but in other countries, directly back to the alcohol industry through some of these think tanks. That's another of the less visible political strategies. Anyway, I think this is my last slide, so I'm just about to stop. I just saw this paper which was published, I think, about a week ago, which I won't go through in detail. I know this is unreadable, but it describes not just alcohol industry, but industry influence on public health policy for formation in the UK, and I think it's more widely generalizable. It's a really nice sort of summary. It has this very nice systems map, which you can read the paper. This is the paper, but it's a really nice summary of the political practices across industries. But it also provides entry points at which you can challenge some of this. So thanks very much.